once I had the privilege of taking care of a patient who wanted to have their newborn baby in the hospital room with them. Now, these are private rooms, and I was on a telemetry unit. This is not a pediatric unit. This is not a labor delivery unit. This was just regular telemetry floor. And you can't really bring babies in here to stay the night. Like, to visit or with someone else, that's fine. If they're your baby and you're caring for them alone, but you have other medical needs, well, who's going to take care of this baby? There's a safety concern in it. So when I was getting reported, I'm like, what is going on? Why do we let a baby in here? I don't know what to do with this baby if something happens to the baby and the mom, what we do. So we go and do bedside report, and I look around, the mom's holding the baby, they're quiet, the room is dark, she's feeding the baby or whatever, and I'm like, oh, okay, dad's over here, and I'm like, hello, we introduce ourselves, and she's let me know that this is the family and what's going on and why the mom is here. I look over at the baby. This is not a baby. It's a baby doll. It's one of those life-like looking babies. And the mother referred to this baby like it was a person, a living being. She was saying what the baby was doing, how old the baby was, what she did for the baby, telling me about the baby, but she's not here for this baby, and I'm not a pediatric nurse. So I was just like, oh, okay. I was like, okay. She started talking about all these things that the baby was doing while I was on the shift, and I just was kind of like had to go along with this. And this is the thing. These are the things that nurses have to deal with, that we aren't necessarily told, like, yeah, when people bring in babies that aren't real to you, they are not visible beings. You have to kind of like understand that we are not here to quell their delusion. We are here to care for their heart needs. So we just have to kind of like refocus our attention, although sometimes it does interact with what you're doing, because it's like, oh, can I take the baby and put them down? Or they'll ask, like she was asking me, you want to hold the baby? You want to do something? I'm like, no, I don't want to hold your baby. I wouldn't want to hold your baby anyway. But oh my goodness, it just was so strange to me. That was when I was a younger nurse, but it still is a strange thought to think that you can't always work with people in their states of mind when they're in some sort of alternate reality. You just have to deal with where they are right now. That's the truth.